Hello, guys, and welcome to another episode. Today, I have an exciting guest, Dr. John Levine. I loved this conversation so much. He can talk for days. You could tell he's so passionate about what he does, all that he's created in the world of dentistry. And I really see him as a biohacker of the dental industry. We talked about all things, practices that we should have to really have this thing he's referring to as dental longevity. This is something that is really important to me, whether you know this or not, because my family has a history of inflammation of the gums and a lot of other things that have gone on. So in my 30s, it's been increasingly more important for me to really pay attention to what's going on inside my mouth to make sure that I have dental longevity. And I mean, we talk about everything. He is definitely an advocate for functional health. He has interesting perspectives and opinions on things that we see in the headlines and things that we may know or talk about in the spiritual world and also in the health related community. But he shares with us ways that we can balance the pH of our mouth, how the mouth is its own microbiome, and how the health of our mouth and our gums really impacts the health of our body. We talk about autoimmune and how that can really come from the condition and state of our mouth and our teeth. He definitely motivated me for the morning practice of oral care because although I come here and preach all about our spiritual and energetic morning practice, I'm realizing how important and how serious I should be taking the oral aspect of my morning care. This was really just a breath of fresh air. The way he explains things, the way he makes the why so clear and breaks down very scientific information to something that's so tangible, easy to understand. It just really it truly did motivate me, and it's the motivation I needed. I think you guys are going to really enjoy this conversation. I will be honest, at first, I was like, why am I doing something about oral care? Like, I love going into the spiritual realms. I love talking about spirituality. And this episode, after you listen, like it will all make sense. His energy, his passion, his wisdom, and his experience. He has such cool experiences in life that he shares here as well. So I think you're going to love it. Thank you for being here for it. And I'll see you on the other side. Thank you so much for being here. I'm excited to get into this conversation today.
Great
We
to be
already
here.
started. We already had
we
so
did.
much
We
to
started
share
rapping.
to begin with. But some things that I really wanted to speak about today was I know inflammation is a really big thing. It's actually something I suffer with in my gums. So I wanted to talk about that. I wanted to talk about some of the trends that we see for oral health, get your hot take on them. I want to hear all about this breaking technology that you're really diving into in your new adventure. And there's just so much to tackle. So I guess we can start with your passion about dentistry, about oral care, and just giving us a little bit of background on you, what you do, and take it from there.
Sure. Well, for me, I have to tell my story, which is a little bit of getting out of college at Cornell, being part of this amazing team, played a sport called lacrosse, which I'm sure you're aware
Yes.
of.
So Long Island of you.
The Long Island of me. Of course I played. And I was lucky to have this amazing coach, kind of John Wooden of basketball. Everybody knows this was Richie Moran of Cornell. And we were a bunch of Long Island guys who played the sport. And what I learned, sophomore year, we lost in the quarterfinals. Junior year, we lost in the semifinals. Senior year, undefeated, national champs. And of course, I played against my fraternal twin brother, Maryland, bragging rights for the rest of my life.
Yes.
As a little aside. But what was interesting was you realize how the magic happens when everybody's loving each other and work together as a team collaboratively. I get out of dental school. I was fortunate to go to Boston University, Goldman School, which is 2 years of medical school and a very strong medical background with dentistry. And I get out of it and I get into dentistry, and it's a very solo sport. And as a solo sport, you know, I was like, oh my God, I can't believe I got into this profession. I love working with my hands and creating things and the patient contact. But from a standpoint of almost the business model, I was from the beginning trying to reinvent it. And I reinvented it in a way to always build teams because that's where I came from. So it's 3.5 decades later, and I've started a bunch of different companies, a foundation that I'm super passionate about, academic program at NYU, where I'm full professor. And I've been able to do all those things, making plenty of mistakes, but mistakes is how we learn. Yeah. And really took a team approach to this solo sport of dentistry. Fast forward now, and it's growing up, and it's starting to become more of that team sport, where what we've developed now is where all the professionals, the specialists, orthodontics, periodontics for the gums. Mm-hmm. I'm prosthodontist, which is the super specialist. You could almost call it the super generalist that oversees the team, does a lot of the aesthetics, designing with the team, if you're able to, and then structure, function, and biology. And what do I mean by that is we take a very comprehensive approach. And so this evolved over time because traditionally, in those traditional methodologies, you would make a referral. Like in medicine, if you need a cardiologist, you make a referral. You have a gastrointestinal problem, you make a GI problem. But whether you're at Cornell or NYU or Sinai, everybody's under one roof. In dentistry, everybody was separate. Different office managers, different office experience. They didn't get back to you in time. There was no real true collaboration. And what I learned is when you put everybody together, all the specialists together, there's this heightened sense of collaboration and communication that is a positive for the patient. What do I mean by that? We meet on a Friday morning, or the data is up on the Zoom, and everybody can go over that data collection, especially with our new technologies that I'll tell you about, and allows us, like grand rounds in medicine, grand rounds in dentistry. And we can diagnose extremely well, and we call that mouth mapping. And we look at those 4 domains of aesthetics, structure, function, and biology, depending on what the needs are of the patient and what the diagnosis tells us.
Interesting.
Yeah, and so that really allows us to kind of take it up to that next level, be very comprehensive with our approach. If somebody's interested in aesthetics, we're not thinking, oh, I do a lot of veneers, you got to have 20 veneers. How we look at it is we design now on a computer, and we 3D print that design, and we could mock it up into the patient's mouth before we do anything. But we also see, hey, do we need to move teeth first before we do the veneers? Because then we can make ultra-thin veneers and, in fact, do less veneers and do minimally invasive and be more conservative. So we follow a methodology where we identify the problem, we then visualize it through these designs, and then choose an appropriate technique that's more conservative. And this allows us to do just better outcomes for the patient. And I'm really proud of that. And I think we can elevate the profession as we think of how do we really put this to action, which then gets me to what we're doing now in a concept called Smile House. With my name, we have the practice up on 5th Avenue that I've had for 35 years, 923 5th. And now we're building a whole new facility, 2 floors. And I call it, you'll love this, the rule of opposites, right? And the rule of opposites means whatever's been done in dentistry, we're doing the opposite. So when you walk into a medical or dental office, what do you see? Right? They're behind the desk, heads are down, they're in computers. There's no hospitality approach. There's no outstanding 5-star in most dental offices. Change that. We're building something that looks like a boutique hotel when you first walk in. It's a digital screens, merchandising, and it's just to build it engaging so then we can educate the patient. So fun. Yeah, and really make what we're doing, I got to tell you, make it cool. Yeah. Make it engaging. Can you imagine dentistry cool? I mean, talk about rule of opposites.
Right, right.
But that's what we're doing. And we found a beautiful space not far from here in Tribeca.
So cool.
On 55 Warren Street. And the best part is I have my 2 sons, Cody and Julian. And I say, you guys are geniuses. They come on our foundation mission. We have a foundation. I have it with Lenny Kravitz, Glow Good Foundation. That's a whole nother story how that started. But Lenny's a patient, and he came running up to me. We came back from our first mission in East Africa. And he said, Doc, I just heard what you're doing. Georgia told me what's going on. You got to help my people. I go, Lenny, you're half Jewish, you're half Bahamian. Where do you want me to go? And he says, a Lutheran. I said, where's a Lutheran? This is 10 years ago. We go down there, fast forward 10 years, we have a 14-chair freestanding clinic, free for the people. Wow. Lenny lives there most of the time. He lives there in Paris. And it's extraordinary. I bring down about 100 professionals. We treat about 1,000 people. We go into the schools. The problem that those people have in these areas, we call them dental deserts, but they're really healthcare deserts. They have no access to care. They have no education, and they have a modern diet, sugary drinks, and their mouths are destroyed by the time they're in their 40s. We've totally reversed that because we've been there now 10 years.
Wow.
And the people who come there, we say we get more out of it than the people we help. And we help the people because we bring in all the dental specialists and medical people and nurses, nurse practitioners, and doctors working side by side with the dental professionals because we believe that the mouth's an ecosystem with the rest of the body and that medicine and dentistry should be connected because it's not connected, but it's starting to move that way. We call it DMI, dental medical integration. And what we learned in that foundation, we now are applying that into Smilehouse of a strong dental medical integration. Well, anyway, my sons got all inspired. They left their jobs. One was private equity analyst, and the other one was marketing. And now we're all doing Smilehouse together.
So cool.
As a fam.
Who came up with the vision for Smilehouse?
You know, it evolved. At first, my older son, Julian, who just got married in September, he had an idea kind of when they started this company called Smile Twice with Lenny Kravitz. And they're in Walmart. They're doing nicely with it. And they now brought on new partners where they freed themselves up on the day-to-day, which is great. And Julian came up with the name, but the concept was going to be more about making it very easy and attractive. So we still believe in that.
Yeah.
But where it evolved to and where I was passionate is how do we elevate the profession? And so how do we have this amazing experience and patient journey for our patients, but also where it can be very comprehensive, where I can put all the specialists under one roof like I have at 923 Fifth, but also have this very important integration because we believe oral health is health care. We believe that if your mouth is healthy, that your overall body is going to be healthy because we can get to problems before they start really becoming something else.
Some problems start in the mouth, just like they say a lot starts in the gut.
That's right. Exactly right. What that is all about is that when you have inflammation in your body, think about COVID-19, what happened with COVID. You were 4.5 times more likely to end up on a ventilator if you had periodontal disease.
Wow.
If you have periodontal disease and you have cardiovascular disease, the number one killer in America, as you control periodontal disease, your inflammatory markers go down for cardiovascular disease, for rheumatoid arthritis, for leaky gut. So we call periodontal disease, which is chronic inflammation of the mouth, periodontal disease.
Why do people get that?
They get it because it's completely related to the bacteria in our mouth. So you talked about the gut. The gut is a balancing act between good and bad bacteria, right? The microbiome. It's called homeostatic balance. Okay. When you take too much antibiotics, what happens to the gut?
It gets thrown off.
It gets thrown off. You have to get on probiotics. You have to really, really watch it, stool sample, really look at the bugs that are going on there. That's because the bad bugs outnumber the good bugs, right? And what's true about the microbiomes of the body, there are microbiomes all over our body. We are, as humans, called holobionts. We have more bacteria in and on our body than we have human cells. Imagine, trillions.
Crazy, right?
It's crazy, right? So the balancing act of good versus bad bacteria in the gut, the same rules apply to every microbiome. In the mouth, we have 8 billion bacteria, about 7 to 8 billion. In the gut, which is the number one microbiome of the body, trillions. Mouth is number 2 to the gut. Guess what? In the last few years, the researchers have figured out that the mouth, when you have chronic inflammation in your mouth, those bad bacteria, the pathogens that outnumber the good guys, seed the gut and other organs in the body. The number one is called P. gingivalis. So to get back to the question, why do you get inflammation in the mouth? Think about getting a splinter under your skin. What happens? It gets red.
Yeah.
If you leave it there, it gets redder. And it's the inflammatory response. The inflammatory response goes 2 ways. One, you get your cells that are initially get to that area, right? It gets there right away. It's called humoral. It gets antibodies go in there, these macrophages that clean the bacteria out. And then if it persists and becomes chronic, it becomes what's called cellular immunity or adaptive immunity. Anyway, this immune response is our body's way to defend from foreign invaders, right? Think we get a flu or COVID, unfortunately, or virus. What happens in the mouth is when that bacteria doesn't get cleaned properly, and our home care, and this is why home care is so important, and our habits, and let's call them high performance habits for oral health, is so critical. If you don't mechanically remove the plaque off of the surface of the tooth, and it happens as quickly as 3, 4, 5 days, the gums get inflamed.
Okay.
If it's chronic, in other words, over a period of time, 14 days, 21 days, a month, 2 months, now your body that is developed and designed to protect you flips the coin to hurt you. So what does that mean? When the body gets overloaded in its immune response.
I feel my gums tingling as we have this conversation.
But I'm going to tell you, it's easy to control.
Yeah.
It really is.
Okay, you're going to tell me all the tips.
There's tips, and there's also, being with good professionals that are really going to look at all the things that are important, because there are things that are important about mouth breathing versus nasal breathing and getting into deep sleep and all these things. But from a plaque removal standpoint, it's just important that you have really healthy habits. And of course, nutrition is important. All the things, just think about it. All the things that we know are important for longevity, for the human body, is what's important for the mouth, because it's part of the body. Last time I looked, that we got bones in our body. Well, we got bones in our oral cavity, which is the mandible, the maxilla, and our teeth.
Yep.
So it's all the rules, the same rules apply. So we call it dental longevity. And our Smile House is all about dental longevity. It's going to be a new phraseology in dentistry beyond, more of this wellness. It's really about taking the habits so we can live a very long, healthy life. So remove the plaque in a very effective way. What does that mean? It means developing habits in the morning and night so that you are mechanically removing the plaque in the very important areas. Between the teeth are hard to get to. Even you use an electric brush, which is 5 times more effective than a manual brush.
It is. I was going to ask you about that. I'm just using that now.
Yeah, so that's great. I got a few more things for you, though.
Wait, does it cause gum recession?
No.
Are you sure?
Yeah, well, yes.
Are you sure?
Well, so that's a little, not that it's complicated, but here's 2 facts.
Okay.
Your gums have 2 genetic predispositions. In other words, if you use a brush too hard, you can cause the gums to recede. But that's when you have a gum we call thin periodontal biotype.
Okay.
Some people have genetically thin, and some people have thick. When you brush too hard and it's thick, the gum gets actually a little redder and a little more inflamed. So it depends on the periodontal biotype, but the beauty of a lot of these electric brushes is that it will tell you when you're pushing too hard. Okay. Like the Oral-B IO, it's a great brush.
Okay.
I have nothing to do with them, but that's the one that I really love. So there's an interesting thing. When you pick up a brush, people pick up a brush. It's like picking up a baseball bat. They grab it in their hand and they think they got to go hard. Nah, you can't. You don't have to go hard. It's literally like brushing an eyelash. You don't have to go hard. You just have to go effective. The beauty of the electric brush is it does all the work for you. Yeah. But it doesn't get between the teeth.
Right.
So that's why the habit is brushing. And then I got to get into the tongue. The tongue.
Wait, flossing.
So I was getting there, but let me lay it all out then for between the teeth, and then we'll go to the order of events. But so flossing, whether it's a water floss and regular floss, is critically important.
Which one do you go with?
Both.
Are you kidding me?
You're going to spend another 30 seconds.
All these
but you're going to live longer.
Habits add up.
I promise you're going to live longer.
Okay.
It's really true. You are going to live longer. So you can do electric brush. I love these new water flossers. We have one that has high power. I'm going to send it to you. 60 PSI. It works fantastic. But I also love a deeper clean, which is flossing properly.
Okay.
So the boys have a floss. They put sodium bicarbonate impregnated on the floss. I love that floss because it raises the pH. Why do you want to raise the pH?
You have that?
We do.
I have to get that too.
I'm going to send you my goodies.
I've heard of the sodium bicarbonate.
Yeah, sodium bicarbonate is good. It neutralizes acid.
Okay.
And I'll tell you,
I like that idea.
Explain why that's important. But between the teeth, so water flosses get everything out from between. Could be food, could be plaque. But then under the gum, where there's no oxygen, those are the bad bugs that live there. They're called gram-negative anaerobes. So when your gums are swollen, those bad bugs, gram-negative anaerobes, there's 7 of them. We call them the pathogenic bacteria. The leader of the pack is P. gingivalis, Porphyromonas gingivalis, and there's 6 other ones, Treponema, and a bunch of nice long names, actinomycetes, concomitans. There are all these great names. But basically, if you get the bad bugs out from under the gum, and that's a C-shaped wrap around the tooth, and that's why your hygienist and the dental team is so important, because it's like a backhand in tennis. You just have to have a good technique. Mm-hmm. So we like the electric brush. We love the water flosser. Then we like to follow that with just regular flossing, but it's kind of fast. And then we love a tongue scraper, because on the tongue, the same bacteria that get between the teeth get within the deep recesses of the tongue, and that's what gives us some bad breath. So when you're in front of the mirror, you stick your tongue out, you see that white film, mm-hmm. A good tongue scraper will take that film off. And then we like to finish with a rinse that raises the pH. And what do you think it does? It oxygenates the mouth. When you oxygenate the mouth, just like you oxygenate the body is healthier. And you're actually at that same time neutralizing a lot of those bad bugs that live under the gum. Under the gum, there's no oxygen, and that's why you want to hit them with oxygen.
I like that. How do you hit them with oxygen? What is that?
So what's in this great rinse, you'd think that I'm touting my sons again, because I am, and I'm completely biased. But they have a rinse called Immunity Rinse, the only one out there. You got to be careful. Any rinse, and all these products, you got to look at the ingredient list. Yeah. There's certain things, sodium lauryl sulfate in toothpaste, SLS, about 12% of the population gets aphthous ulcers. There's some rinses that have alcohol. Alcohol dries the mouth. It has an opposite effect. So what the boys have created, and I've lived in that world myself and helped them with it, is you want to oxygenate with a very low level of hydrogen peroxide, about 1.5%, and then you want to put it with sodium bicarbonate. You have to use a very specific design delivery system to have both of them live separate. Mm-hmm. And then when you push the little actuator down, it comes together. And that's their immunity rinse. And it's just a great, carry it around with you. It's just a great mouth freshener, but it's not camouflage. You're really getting rid of the bad bugs and you're neutralizing the pH.
Oh my gosh, you are making this fun. Like, I want to go home and do the
you
whole
want to
regimen.
do this.
I want to do it.
And your mouth feels fresh.
Yeah.
And that's what the patient experience should be also in the dental office, because your hygiene team, and by the way, the hygienists are like the rock stars of the dental office. They really are. They're fun, they're engaging, they're informative. Dentists, the dental specialists, we're all working, but they're the ones who can really communicate a lot of these things. So, the really good dental offices have great hygienists, and they can educate and elevate the patient to be inspired to say, okay, I have to take care of my mouth.
Yeah.
It's important.
And all of those things will help with inflammation. I have inflammation in my family, and I think I've inherited some of it. Yeah.
You got to do all the things. So think about longevity and what you do personally when you wake up in the morning. Mm-hmm. Nutrition, what you eat.
First, meditation. Always first.
Meditation, journaling, breath work.
Yes.
Right?
Yes.
Right there with you. Do the same. Then I do a good workout. Every morning I take one day off. I've been an athlete my whole life, and that's what I live for. My sons are into it. In fact, I ride with my younger son. He's a triathlete, and I can still hang with him most of the time. Not on the hard hills, but it's that breathwork, meditation, journaling. It's getting that fitness in, but then proper nutrition, right? And of course, proper sleep. And we'll talk a lot about sleep. And then it's how do we, because of that breath work that you do, right? It's how we deal with stress in our lives. Yes. At the end of the day, stress is good for us, right? Stress we learn things from, but it's really the ability to be calm and to manage it properly so that we take those learnings, we play it forward, and we develop that wisdom as we get older. Yeah. Right. So it's those 4 domains that we live by. Well, within those domains, what you do in the morning, now we do morning and night, you do an oral health regimen. Because once you understand how important it is, because our immune response, the way it's built is when it gets overwhelmed, if you have cardiovascular disease, who ended up in trouble over COVID? Because everybody remembers COVID. Yeah. Unfortunately, those are the people that had an underlying inflammation in their body, systemic inflammatory disease. Every disease of the body is inflammatory. That's just the way it is.
Can I tell you something? I know when I have COVID because my gums hurt.
Right.
How crazy is that?
Yeah, because your gums are more sensitive to the plaque.
I'll know.
Yeah. Think about it. We get a cold. How do we feel? We can't get out of bed.
Yeah.
We're exhausted. It's called malaise. We're tired. Our body is fighting the foreign invader. Now you have periodontal disease on top of it. So now the immune response gets overwhelmed. Now what happens? That's when people develop these autoimmune diseases. We start attacking our human body because we think it's a foreign invader because it's just overwhelmed.
Yeah.
The signaling gets thrown off. That's exactly what happens in the mouth. We get bone loss around teeth. People lose bone from periodontal disease because that inflammation is going on for too long because they're not cleaning the plaque off the teeth in a timely basis.
This is so
It's
serious.
and it's pretty simple to understand though, right? So we say, okay, you want longevity, and I'm talking overall health and dental longevity, you got to develop everything you talk about. You have to develop proper habits.
Yep.
And those habits have to be who we are. And it's all about the rhythm and doing them timely.
Yeah.
Yeah.
Wow. So tell me about sleep and how this relates to longevity with dentistry.
So what's happened over the last, I'll call it 7, 8 years, 10 years, is there's a machine called CBCTs, computerized tomography, for dentistry. It's basically a CAT scan for your jaws.
Okay.
It's working its way now into the dental offices. I believe in the next 5 to 7 years, it'll become a standard of care. That means every dental office will have it. I've had one for about 7 years. The first ones, we just got a brand new one. What does it tell us? It tells us everything from the top of the nose, so we could see all sinus problems, TMJ joint problems, right? TMJ, MPD problems, and then all the way down the throat to the airway. Why is that important? People who have sleep problems, the majority of the problems are caused by obstructive sleep apnea gets developed. In other words, an obstruction. Where's the obstruction? In the nose, in the throat, in the palatal tissues, or in the airway. So when people are mouth breathers, so you have a deviated septum, you have a sinusitis as a young developing person, you are now breathing through the mouth. In the developing person, the jaws develop according to what they are functioning as. So if you see a person with a very narrow, and we call the upper jaw and lower jaw arches, they smile, there's a lot of shadowing on the side. The jaw is small. Unfortunately, that person...
What do you mean shadowing? They smile.
Oh, so we call it the buccal corridor, but if the arch form is nice and wide, like we do with orthodontics, or person develop like that, when you smile, you see a beautiful curve of teeth from the front to the back.
Okay.
If the arch is narrow, there's very...
Like a smaller smile?
Very small, exactly.
Okay.
Smaller arch forms, and it gets very shadowy to the sides of the smile.
Okay.
And we show people what that's all about.
I gotcha.
So small arch forms. Think about, I live in a penthouse apartment versus I live in a very small studio. People with those small arch forms, they're now they're living in this small studio. And what has to happen is that has to turn into a 3-bedroom penthouse.
Got it.
It's got to get big. But what happens when the young people are developing, because they might be mouth breathing because of an obstruction, that impacts growth and development. In us adults, we mouth breathe. So that causes the gums to be inflamed because it dries out the mouth. Saliva is very important because it's a buffering agent. All right, so you're getting all this. What we can determine whether somebody has a nasal obstruction. Oh, I know I have a little deviated septum. Well, do you breathe through your mouth? Well, I'm not really sure. Mm-hmm. Well, and all we got to do is just hold one nostril, hold the other. Yeah. And they don't breathe too well.
You know.
Okay, let me go mouth tape. Mm-hmm. I want you to mouth tape. I want you to start breathing through your nose, because you breathe through your mouth. Your mouth is not designed for breathing. Mm-hmm. It's the top of the digestive tract. It's for digestion. We have all these enzymes in there that initially breaks down food. The nose is a filter. It's breaking down that air so that it's getting into your lungs. That's how it's designed.
Yeah.
Let's get it back to the design of it. So your mouth tape, if you can keep that tape on, that means you can breathe through your nose. If you have to rip it off, you have to rip it off because you have to breathe. So we can diagnose nasal obstruction. We work with the ENTs and we make a referral to, we got to really figure out how do we get, that deviated septum or whatever's blocking repaired.
Yeah.
And what we know from sleep now, because as we see obstructions, we look in the mouth and we see where these palatal tissues are, just like the face, where every 10 years, everything drops because of gravity, the back of the throat is like that. So older people, might be overweight older people, gaining weight, neck circumference causes that airway and the palatal tissue to block your breathing. So what we can see on the CBCT machines is the blockage, and we can see a number. And people who are below 130 square millimeters, we know that they might be having trouble sleeping. What's that a problem? If you can't really breathe and you're waking up in the middle of the night, right? There's a whole hypoxia-apoxia ratio. Okay. If you're waking up, you're not getting into deep regenerative sleep. That's the sleep that saves our lives.
Yeah.
Prevents oxidative stress, which are the cancers. It prevents hypertension, high blood pressure, which then leads to all the other diseases, cardiovascular disease, and all these metabolic diseases like a diabetes. Okay, so sleep is critical. There's light sleep, REM sleep, deep sleep. Deep sleep is the regenerative sleep, and it's critical. So if you wear an Oura ring, and even if you put it on just at night, you can see how that breaks down, and it drives our behavior. So the dentist now can diagnose, work with the medical colleagues, and today as dentists, there are multiple solutions for people with sleep issues. If it's a palatal tissue, we have these fantastic lasers that are like collagen synthesizers and help pull up the tissue. We also have these appliances, they're called MAD appliance, mandibular advancement devices, that pull the jaw forward, which opens the airway because you're pulling the tongue forward. When you're sleeping, you go to sleep at night, put your tongue right behind your front central teeth, right? And go to sleep like that. And what that does is that moves the tongue forward. For people we diagnose with obstructive sleep apnea, slight to moderate, and we do a sleep test, of course, and people used to have to go to a special place for it. Now there are these great devices over 2 days that we can see all
at
these
home,
at
right?
home. Yeah, this AHI ratio, apoxia, hypoxia, how many times you wake up, and we can see all of these important KPI metrics to see, do you have a sleep issue? We work with our sleep doctors because we want to get their input, their diagnosis, but it's really the dental sleep experts. And for us, at JBL Uptown and Smilehouse soon, we have all the specialists under one roof. So we understand the sleep diagnostics and then able to offer these solutions. The MAD appliance is pretty terrific because what has happened in medicine is the insurance companies drove the solution for sleep problems. It's called a CPAP, and it blows air down the nose and through the mouth. It's great for an acute situation, but it's not a great long-term answer. If they're like Petri dishes and full of bacteria. And
it has to go with you wherever you go.
And it goes wherever you go, and it's just not a great answer because you're pushing air down, and you end up pushing the palatal tissue over time down the throat.
Okay.
And so what the researchers have seen now that these mandibular advancement devices that move the tongue forward work extremely well. In addition, people for those tight arches.
Wait, how does it move the tongue forward?
Because the minute you move your jaw forward, guess what the tongue does? It comes with it.
So you put something in your mouth and it like resituates
Think
your
of
mouth?
a night guard. If you've never seen a night guard, even an aligner, like for orthodontics, those clear aligners, you'll have one on the upper jaw, one on the lower jaw with a little bit of a hinge that keeps the lower jaw forward, which keeps the tongue forward. That's why when you go to sleep, it's always good to have that tongue right behind the front teeth because it allows you to move the tongue forward, not sleep on your back, sleep on the side. There's all these sleep hacks.
Right.
Room at 67 degrees, no blue lights, block the blue lights, don't have your phone near.
What's the 67 degrees about?
Nice and cold. It's just the studies show that you get into better sleep with a cool room. So you got to try to get under the covers, but you want a nice cool room.
Yeah.
No phone on the end table the last few seconds, no alcohol, no sugar, the last 3 hours before you go to sleep. Give yourself wind down time because, we call it sleep hygiene. There are all these things, just like oral hygiene. There's all these things you do before you go to sleep. When you realize how important, as we get older, how important sleep is.
Yeah.
Yeah.
Wow.
Yeah.
Oh my gosh, you're giving me so much information that I need. I want to come and get the scan.
All right, you're coming.
Everything.
You're coming, but look, at the end of the day, it's going upstream. It's
Yep.
getting preventable before you develop
Exactly.
chronic inflammatory disease.
Yeah.
We say oral health and dentistry is the tip of the spear for diagnosis to prevent systemic inflammatory diseases. That's what we like to say.
Yeah.
We believe oral health is overall health. And that's why the concept of mouth mapping and dental longevity, that I believe that the profession will move that way. And I've always felt this way. And I'll go back to my college days. You got to build a team, right? We can't do anything alone. We like to say life is a team sport, right?
Yes.
Think about it. All the things we do, it's the people we surround ourselves with.
Yeah.
And everybody brings their superpowers to the table, and we know what happens. The magic happens.
It's so
Things can
true.
really get done.
But it takes someone who has that gift to like hold the space for a team. Like you have a gift where you want a team, you want to hold the space for a team, you want to build that, because that takes a lot of energy at first too, and then it pays off, of course, but it takes a lot to gather that and rally together.
But it brings the joy for us.
Totally.
Right?
Yeah.
You told me you used to teach.
Yep.
When you had a great class and you knew that
It's so
people were
true.
getting it, you felt so
Yeah.
good inside.
Yep.
And for me, I've evolved. I've learned so much over the decades because I'm one person. I do like to push the envelope. I do that in the sports that I've played, and I do it in for me, it's a mindset. And I've learned that to lead teams, you have to build an environment for people to thrive.
Exactly.
Right? We call it servant leadership. We serve. And my most joy I get is out of the foundation because I have all my colleagues there. I used to lecture a lot around the world because I was one of the first guys to do porcelain veneers, literally 26 years old.
Really?
And an amazing person named Adrian Durham I meet, and he shows me something he figured out with a guy named John Gwinnett from Stony Brook, how to etch porcelain and bond it to teeth. And I'm 26.
Really?
It's like if I was an actor and like De Niro discovered me and he put me in a great movie.
crazy.
So that was it. It kind of launched
Wow.
me. And I'm
So
lecturing
cool.
to dentists 30 years older than me about this technique.
So cool.
And I didn't have any experience under the belt, but I was lucky. I went to a school, Boston University. And then in fact, I go back, I get my postgrad after 5 years of practicing dentistry. But I say that because it got me on a path of thinking differently, right? Of how do we innovate? And I've learned so much over the years, but my most happy days is my moments is a lot of times in this foundation, we have this big building that the church gave us, very poor side of the island. The wealthy side is called Harbor Island. People go there. Well, when you go into North Eleuthera Airport, you go to the other side over this little skinny bridge, and there's a town called Gregorytown, and Lenny lives in that area, and that's where we landed. Well, everybody's in this room. We have a 14-chair clinic. The medical team has a big tent outside, and we all work together. And it's amazing. And I sit there and I watch everybody. And there's a lot of my colleagues from here, my team, we have about 27 people up at 923 Fifth. We call it JBL New York City is the practice uptown. And it's pretty special. And that's where I go where, life's a team sport in that every specialist is there. We have oral surgeons. My friend Jason Auerbach, he's called the Bloody Tooth Guy. He's amazing. Jason
He
Deblinger.
sounds scary.
What's that?
Bloody Tooth Guy sounds scary.
Oh no, that's his Instagram. And if you met him, he's so not scary, but he's got a number of amazing offices. And I'm not going to say he makes oral surgery fun, but he's highly competent. And what I find is, the people that come on these missions, a lot of them are like they're top in their field, but they know that to do well, you also want to do good.
Yep.
And it fills you up.
Yeah.
And it brings a joy. And it's
So
really some of
true.
my happiest moments because I got my family there, and then I got my other family there,
That's
my
so
team.
nice.
Yeah, and it's quite good. But it's the leadership part. For us, when you're building teams, is really just thinking about things in the context of how do you make everybody the best they can be.
Yeah.
And that's where I've landed, and I'm loving it. I'm loving it because I got my family. I mean, my sons and my wife, Stacy. My wife, Stacy, and I have started 2 companies together. We started a company called Go Smile. It was her idea. Let's go bring these products. I developed some products, but let's put into prestige beauty. So there we were in 2002 to 2008. Sephora, Saks, Nordstrom, like they had dermatologists, Nick Perricone and Dennis Gross, who's a dear friend. They had me there at Sephora.
Really cool.
And it was cool because we had oral care products. Oral care was always in the drugstore. And so Stace did the branding and the marketing. And then we sold that company. And then we moved on to the current company, which is called Glow Science, where I was on my bike. I got off. I drew this picture because I had this thought that, oh man, compromising these in-office whitening lights because they get too hot and people get zingers. Tray and gels are messy. Well, why don't we kind of do two innovations, make a gel that sticks to the teeth and make a light that's in a closed system that doesn't get too hot, control the temperature.
Cool.
Glow Science.
Oh my gosh, you do everything.
Well, that was
Wow.
over, I'm defining it 35 years, but yeah.
Really cool.
Yeah. But it's that mindset that
Yeah.
how do we improve things
Yep.
on every level? It goes
Totally.
for our relationships too.
Yep.
Are you married yet?
Yes.
Well, there you are. You know it.
Yeah.
We got to work at it.
Yep.
I'm married like 1,000 years.
1,000.
I'm telling you. And
It's
we
fun
still love each other.
It's fun to be in business with your partner too.
It's
right?
amazing.
Yeah.
It's amazing.
It's fun.
Yeah.
So nice. Wow. So much accomplished. I want to try everything now, research everything that you've created. I'm thinking I know with the gut biome, there are certain things that we will eat that will throw off our gut biome or antibiotics. I'm assuming there are things that we drink or we eat that would throw off our oral biome too. Is that true?
100%.
Okay.
Same rules apply.
I'm thinking alcohol is probably one of those things.
Yes.
Anything else that comes to mind? Maybe an everyday thing we might not realize.
Well, I have a sweet tooth, right?
Sure.
Everybody's got a sweet tooth.
Yeah.
But you're looking on the ingredient package. You make sure that it doesn't have a lot of added sugar.
Mm-hmm.
You don't have anything sweet right before you go to bed, a couple of hours. But sugar is the enemy.
Yeah.
Alcohol, unfortunately, for everybody who likes alcohol, is the enemy from the latest research, and it's all over, podcasts and people's news. So it's controlling these things. Can we have a little cheat days? Of course we can.
Mm-hmm.
But as a regular diet, there are two ways to think of food and nutrition. It's alkalinizing, in other words, it's a fairly neutral pH, or it's acidifying. For the mouth, acidifying or the acid, low pH, and that's why we pH test everybody in our office. I don't know if you've ever been to a dental office, they take
No.
pH. That's a standard of care. And we look at so we go aesthetic, structure, function, biology. In biology, we'd go oral cancer exam, pH testing, salivary diagnostics, and all the periodontal examination stuff. On the pH, if it's too low and too acidic, you can demineralize the teeth. In other words, acid, decay. And you can create an environment for those bad bacteria I was talking about, the anaerobics that kind of cause inflammation.
Yeah.
They can over-colonize the bad guys.
Okay.
So pH is a very important metric to test in the mouth. If our diet is too acidifying, which is all the proteins, so steak, chicken, fish, the balancing act is 60-40. 60% alkalinizing, 40% acidifying.
Okay.
The alkalinizing is, what do you think? It's all the vegetables. That's what Mom
vegetables.
always told us.
Yeah.
Fruits and vegetables. That'll be alkalinizing, and that'll give that excellent balance. So that's just a very good balance for people to think about. And the same rules apply to what? To our bodies.
Yeah.
That's just the truth. There's so much misinformation on nutrition because our nutritional science has changed so much.
Mm-hmm.
But it starts with education. I love talking about this because medical schools, this is 2025. What percentage of medical schools do you think teach nutritional sciences?
I heard barely any.
So when I went, because I was in med school for 2 years at BU, no nutritional course. Today, less than 50%. And this is today. And so when you listen to a Casey Means and a Mark Hyman and a Peter Attia and Victor Luongo and all these functional medicine people, they're the ones that are really breaking it down correctly.
Yeah. I love Mark Hyman.
Oh, I love Mark Hyman. Yeah, he's special.
Yeah.
I mean, he's like, the father of this functional medicine.
Yeah.
He's come to me as a patient. I gotta give him a call. But
He's really
a
cool.
fantastic guy. He's very special. And Casey Means also, who is going to be working with Kennedy, hopefully, is an amazing story. She has a great book called Good Energy. And the conversation is, you got to get, what's that?
Did you say
Casey Means,
Okay.
MD. Started as an ENT surgeon and moved into functional medicine. She's close with Mark, and she wrote an amazing book. Fantastic when you can hear her on the different podcasts, what she writes. But it's all about, what she talks about is a proper diet. And unfortunately, our environment are so messed up. Our oceans are messed up.
I know.
So we have to be eating organic. We have to know where the food
Yeah,
comes from. Farm
exactly.
to table is so critical.
Yeah.
Preservatives, artificial this, artificial that, ultra processed food,
Yeah.
sugars. There's 58 to 60 names for sugar that the big companies are hiding the fact that they're putting all this ultra processed and high fructose corn syrup into our food. So you really got to be very watchful for all of these things. And if you do, our body, what we put in it, just like our good cars, is going to run more effectively. So people, look, knowledge is power, as we know. And this is why you have your podcast. And this is why I come on these podcasts. We want a podcast like yours because we have this opportunity to really educate people. And then people now start digging in deeper and they unpack this conversation and they learn. And that learning is going to drive behavior and it becomes actionable. And we really can take action on these things. And we're not sitting back. We're saying, all right, your generation, I think, is fantastic at this. That they really want to learn these things and to be healthy. You know, all of these diseases, when you go upstream, meaning when you get wellness and preventable, and you get to these problems early on, just like the mouth, they don't become these chronic inflammatory diseases. Right. The mouth seeds the gut. That P. gingivalis, it is in the interstitial cells of leaky gut. What happens with leaky gut? Those terrible toxins get into the body. Well, they found that bug in those cells. What's it doing there? And it also goes the other way. It goes the other way. There's a bacteria that's in the gut, that's only in the gut, that ends up into certain fluids in the mouth. Imagine. These are some new studies. So things that we knew before 10 years ago, because of the new modern research and all the science and all these breakthroughs, we know so much more. And as people learn, we can take care of our bodies. And this whole longevity concept is real.
And even learning on the level that you broke it down today, like how you broke it down makes me truly want to take care of it. But it was also empowering because like I know my family has inflammatory disease of the gums. I know that I have signs of inflammation. And part of me is like, oh, that's annoying that I inherited this. I have a very different lifestyle than my family. Why would this happen to me? But hearing about being able to catch it before it becomes chronic and being aware of it and the ways to take it was as informative as it is. Sometimes when we have so much information, it can kind of like disempower us with the food. Sometimes I'm just like, well, what am I supposed to eat at this point? Because it's just so hard to have access to clean food. But I felt like this was so empowering because we do have control over the extent of it. And like, yes, these may be the cards I was dealt, but my lifestyle will make it better. Exactly. And the things that I do and the practices that I have to follow up there too, you know, and really take action there.
It's very true what you're saying. You know, it gets complicated, but when you take complicated, what scientists do is they break it down into the component pieces. That's why we like to talk about diagnosis in those 4 domains of aesthetic, structure, function, and biology. And we have technology that leads up to it. It's the same thing with everything else. So when you break it down, what you talked about, the genetics or familial history, is very true because we all have what's called a different host response. Some people might not clean their teeth and they won't see that quality or that volume of inflammation that somebody else might. It's how we respond to these foreign invaders, because that's how the body is built. We have inflammation that is built to protect us, but when it gets too much and too overwhelmed, it works against us. It's the other side of that coin, right? 2 sides of that coin. So someone like you who might have family histories, people have family history of cardiovascular disease or diabetes, we have to be hyper diligent.
Yeah.
We really do. It's like pregnancy gingivitis. Somebody's pregnant, the hormones are flying all over the place. The gums get inflamed very easily. Somebody with diabetes, it's bidirectional. You're going to have periodontal disease. You have periodontal disease, you have a greater chance of getting diabetes. It's this bidirectional problem of what's called causation. One thing can cause another thing. And then there's some diseases that go both ways. Interesting, right? So for many of the things we're talking about of the 4 kind of pillars of health and longevity that we talked about, of managing the stress and the diet and sleep and you know, how we think about fitness and motion, which is critically important. It's the same thing for the whole body and, of course, the mouth.
Yeah.
And once you break it down into those component pieces, and I think what you'd love to talk about of these habits that you start the day with sets you. It's just, we're just adding some extra habits to it.
We're adding a few extra steps. That's it. That's it. My morning routine's already 3 hours long. I wanted to ask you about oil pulling.
Yes.
What are your thoughts on that?
If you look at, there's no great research. I'm always research based. There's
Okay.
no great research to really show that oil pulling is working effectively. There's tremendous amount of research on the Cochrane reports, hundreds and hundreds of articles of toothbrushing, electric toothbrushing, on flossing, on all of these types of things. However, there's enough that it's an Ayurvedic medicine.
Yes.
It's years old.
Mm-hmm.
If you do it, it's not going to hurt you. It can take upwards to 10, 15, 20 minutes. If you spend 4 minutes on your oral health regimen that we talked about, and you want to do oil pulling, go for it. But just don't replace it with these basics that we're laying out.
Okay.
Okay? So it's not going
It's
to
an
hurt you.
add-on.
Yes, pulling oil through your teeth will probably have some effect of pulling the bacteria. Remember, it's the plaque, the bacteria that form what's called a biofilm on the tooth surface. And then, to give you a little deeper, you're going to be a scientist on this. As the bacteria grows, it creates a canopy near the gum level.
Okay.
In other words, oxygen starts getting depleted,
Blocked, yeah. Okay.
blocked. Then it becomes no oxygen.
Mm,
And bacteria are two forms: live with oxygen or live without oxygen.
got
The
it.
ones who live without oxygen are the bad ones.
They're not good.
They ain't good. We got to get rid of those guys.
Yeah.
And you don't want to get rid of them totally. That's why you don't want to rinse with like an antibiotic rinse all the time,
Mm-hmm.
because you need them.
Yeah.
They're called that homeostatic, remember, the good versus bad bacteria balance. So, you know, you just want to kind of be conscious of these types of things.
Okay.
Yeah.
What about fluoride? It's very controversial in the
Yeah.
spiritual world.
Fluoride. Look, I love talking about fluoride because, you know, there's a lot of noise out there.
Mhm.
I like to sometimes try to dispel myths, but I'm always going to comment from a science standpoint. Number one public health win ever. That's fluoride. Let's get that out there. In the 60s, there was no fluoride in a lot of other oral care products in the 60s. 60s, 70s, it was about a 64, then a 58, then a 50% decrease in decay, saving
Of the
people
teeth.
of the teeth.
Okay.
Okay. What happens when a person's young is fluoride gets into the tooth formation and it creates what's called a fluorapatite molecule instead of a hydroxyapatite molecule. What does that mean? A very hard tooth, almost impervious to decay,
Mm-hmm.
like super Teflon coating, right? That fluoride's inside
Yeah.
the tooth. Okay. But it's very dose specific. So if you have too much fluoride, and I'm talking about high fluoride, you have a lot of fluoride in the water in Africa, you can get brittle bones. Fluoride at a high concentration is a neurotoxin and causes real problems. Okay, but they've studied this. The United States has studied this, thousands of articles at this point. So the point of taking water out of fluoride needs to be probably a local decision, which is okay. Because there are areas of this country that are dental deserts, we call them, right? No access to care. Those people, if you take fluoride out of the water, you're going to see decay rates skyrocketing. And if you don't have access to care and you have decay, those are life-threatening diseases now.
So they've been putting it in water to help people's teeth?
Totally.
Okay.
Totally. The problem is that if you look at some of the science at very high doses of these fluoride, now fluoride is in very low amounts and this is all FDA controlled. So if you have 1,500 parts per million to 2,000 parts per million, you're not swallowing toothpaste. Mm-hmm. So it's in your toothpaste, might be in your oral care rinse, it's in your water. Now you're getting it from 3 sources. But even those amounts from the studies are not going to have a problem. But you could be waving a flag like Kennedy's doing and say, you know, you got to take fluoride out of the water, except the problem is the people who do not have great access to care, who can't get fluoride treatments, who might not have access to even fluoride in a toothpaste, they're going to get dental decay, and the dental decay left unchecked, you get into a root canal problem. A root canal means the nerve died.
Mm.
Now you have an inflammatory response at the end of the root. That then travels. If it travels to the brain because it's from the upper jaw, you can get any type of brain encephalitis. If it travels to the lower jaw, you get an airway that's closed and you can die from an airway closure. These are life-threatening. So this is people who don't have access to care. We don't have this problem because the minute you have a pain problem, you're going to the dentist, you might need a root canal, and we have access to care. So you really got to be careful about taking fluoride out of the water. And it's got to be, very locally figured out because every state is different. Every locale is different. So it's different today. My point is in the 60s, you needed fluoride. It is 2025. We do have fluoride in a lot of products. If you have access
What if we don't use fluoride products, though? I don't personally.
Yeah.
Is that a problem?
Well,
do you see it as a problem?
What will happen if you don't have any fluoride, you're just missing out on the opportunity to there's two ways. It gets into the tooth when it's forming, but for us who the teeth are already formed, it has an effect of creating a very smooth surface so plaque doesn't stick to it as well.
Okay.
Also, when you get recession, the roots are exposed and fluoride will help prevent decay on those root areas.
Okay.
So you might, as older people, saliva goes down, not you, but as people getting into the 60s and 70s, saliva goes down, you lose that buffering agent, recession, root exposure, you get more decay.
Okay.
So fluoride will help prevent that decay. So you just have to, if you don't have fluoride in the water, you don't use fluoride toothpaste, you're personally against it. You just have to be absolutely meticulous with your home care and really coming into the dental office, I would say every 3 or 4 months to make sure every little problem gets really looked at.
Got it. Okay.
Yeah.
Thank you for that. Thank you. You were so helpful. I feel like I could talk to you for days about all of this.
Oh, I love talking about some of that stuff, but
so good.
The other one is about, hear somebody talking about root canals. You got to get your teeth out if you need a root canal.
I've heard this too. Yeah.
Oh my God. Nothing could be further from the truth.
I sent my husband to a holistic dentist to get everything ozone oxygenated.
Ozone's good.
He was having I think it was a part of his cheek. Something was turning a color.
Okay.
And I was like, we're going to go get that taken out and looked at. So they've been replacing some of his
silver fillings,
root canals or the metal that he had in there with other alternatives.
That's a big conversation. Because that's the new science. So amalgams you got to get out, especially if they've been in the mouth 15, 20 years because of the mercury that's coming off.
That's
mercury
what I wanted.
Vapor.
Yeah.
So that's true, 100%. Root canals, when done by a specialist, done well, because you got to have good access to care and you got to know who the good specialists are. When done well, and that end of the root where you have that inflammation has to get sealed well. When they're not done well, then they will leak, and then yes, you will still have an immune response.
Okay.
So the body keeps working overtime with that chronic inflammation to defend against it. But when root canals are done well, they absolutely work.
Okay.
So there's a bunch of these things, information that's getting out there. I just kind of want to get it out there.
Now they're not using heavy metals to fill the root canals?
No. Okay. I mean, I've never used it in my practice. I think 30 years we haven't used amalgams. There are better materials today. Okay. There are ceramic materials. There are composites. And we don't use silver anymore because, these amalgams, that's an amalgamation. And mercury is in that amalgamation. So and
it just leaks into your system?
Oh, yeah.
That's so scary.
Yeah. What you'll see, and people, when they get blood tests, and this is the difference between Western medicine and more of these functional medicine people, you really want to do a heavy metals test.
Yeah.
Oh, my diet's great and I'm having salmon. Except if the salmon's from the Atlantic Ocean, you're in polluted waters and you're going to have a heavy metals problem. 100%. Has to be in fresh water. It's got to be in Alaska or Norwegian.
Where are you getting your food from?
I'm a little bit of a maniac.
I can feel it and I need it.
Yeah.
I'm a maniac too. Tell me where you're getting it from.
We have to be, I live in Colorado also. I will not, let's say we go to a restaurant, which is really hard. Then we'll talk about home because home, there's all these great answers because you're looking for organic,
Where are you ordering your fish from?
Yeah, I have a couple of places that.
Tell me. What
Yeah,
are
well,
they?
because I need my Stacy Levine here because
Okay, Stacy, we
she's
need you.
she's got the name of
She
these
has a name.
places.
You're gonna have to
Yeah,
text me
there's
that.
like one place which is a hydroponic farm, and that's where they do the fisheries, and it's all the special water that they have.
Wow.
Then you can get fish. You get fish. When you buy it, we have a fantastic fish place because I live right on the Greenwich border in Connecticut, Purchase, New York. So there's a great fish place that everything is organic. The
Okay.
salmon is exactly from the places that it's not large oceans, right? Because, the bigger the fish, the more of a problem, right? So you're thinking about, tuna and these
Yeah.
larger fish. And as you go smaller fish, they're safe. But what water is it in?
Yeah.
And what are those larger fish eating? Right. So that's the
I was
problem.
just thinking about this the other day. I've been getting these packets. I think it's skipjack tuna from Trader Joe's because my cousin, she's a nutritionist. She told me there's less mercury. It does say on there that it's mercury tested and whatever else. But I did see that it's caught in Thailand. And I took a moment to be
don't eat
like,
tuna.
how's the water in Thailand?
No.
I have no idea.
No idea.
No idea.
no,
And
no.
then I started to think like, oh, there goes my
No,
lunch.
no,
Like,
no.
I don't know.
No. If you're getting sushi, yellowtail, you got to ask where the salmon's from. Whenever I go to a restaurant, where's the salmon
So
from?
never the Atlantic Ocean.
Never.
Where
And-
do you look for?
So you look for Alaskan.
Okay.
You look for Scandinavian country, Norwegian, good. Scottish, usually pretty good, but not Atlantic.
Never Atlantic.
No, the oceans,
Okay.
unfortunately, they're
Yeah.
polluted. They really are. So you got to be a bit of a maniac and learn, what's
Mhm.
right. I'm what I call it the flexitarian. I'm kind of vegan plus, of course, I want to have the protein. So I
Yeah.
will have, the smaller fish. I'll never order meat in a restaurant. I haven't ordered meat in 25 years, but I always take a bite of my wife's because I cheat. I
Yeah.
like to cheat every now and then, but I don't have a desire
So
really
she's
anymore.
not
No,
following
no, but
any
she's,
vegan or
but it's
vegetarian
also,
flex.
grass-fed, organic, and you're shopping in the kind of, Whole Food,
Yeah.
Wegman type places that pay attention to these things. So we feel good about it. Now the test is when you go to the doctor, you get a heavy metals test,
Mhm.
and you do all those kind of blood tests. And the heavy metal tests are, that'll tell the story. Is it arsenic or mercury that you have, these heavy metals in your body and in your bloodstream? Because a lot of them, get incorporated into our
Yeah.
bodies. And there's ways to get rid of them, of course. So
Mhm.
that's why you get a blood test, and that's where I was going with the functional medicine people. They're very aware of these
Yeah.
types of things.
Yeah.
Yeah.
So helpful.
Yeah. Yeah, we just got to be, just
Do our
going after it
best.
all the time.
I know.
Yeah.
It's like another thing to do, but it's part of the world we live in. So we just have to do it and be conscious of it
It's true.
and be aware.
It's true. And,
Yeah.
and people have to be understanding that we have to serve our kids
Yeah.
and the next generations, just like the
Yeah.
generations before us did.
Yeah.
And for us not to have a focus on the environment
Yeah.
and to take laws away, what's happening right now, I'm not going to go there, but people just have to be aware how important it is. The environment we live in and the potential of pollution destroying this planet.
Yeah.
And for future generations, just go out a couple of different generations. So
Yeah.
I just make that one remark.
Prayers for the planet.
Prayers for
Truly.
the planet.
Thank you so much. This was so wonderful.
It was
I
great
can't
to be
wait
here.
to go and see all the amazing things that you've created, that you're in the process of creating. And I thank you so much for all the wisdom that you shared. Truly.
Thank you, Erica. Thank you for having
you.
me.
Thank you. Thank you guys so much for joining in on this episode. I hope that you feel as inspired as I do to take care of our oral health and to really maintain that oral longevity. He's incredible. I'm going to link his Instagram if you want to follow along with his journey. And I also want to link the products that he mentioned as well. So you'll be able to find those in the show notes. But thank you for joining, and I can't wait to see you next time. Sat Nam.